Hello, good morning, children. 103 comments in the last class. A bit disappointing because I expected more than that, and I know your count is more than that. So, today, after you see the video, everybody please make it sure that you post your comments, because if not, I will have to inform your teachers that you are not seeing your videos regularly, or should I say that you are not seeing my videos regularly. Whatever it may be, it's an important topic because you will be getting a lot of general questions from this chapter. You are aware about your surrounding, you know what are the changes that are taking place, but we need to put that in a more scientific approach. That's why we are learning the chapter. Okay, so continuing with our chapter itself, today we shall be seeing about the topic, what does disease look like. See, if in front of you you are having two friends, one friend is a healthy friend and another one is having some type of discomfort in his health, won't you be able to identify that who is more healthy and who is having a discomfort? You'll be seeing that the person who is having a disease would be a little bit lethargic, who would be complaining about pains. There would be some symptoms that are being shown by the body. What did I say right now? There would be some symptoms that would be shown by the body. There would be some signs that are being shown by the body. Like for example, during your lockdown times, if you were not into the regular habit of reading the books and you are always in front of your TV, your laptops and your mobile games, you will be noticing that your head starts pain, your eyes would be having a strain. What is this symptoms indicating? These are the signs that are indicating, these are the symptoms that are indicating an over stress to your eye. So it may lead to a disease, a eye related issue in the nearby future. So every time when our body is not functioning properly, there would be some signs that our body will be showing. Like for example, if our digestive system is not functioning properly, we have some discomfort in our stomach, we have discomfort in digesting our food. So it relates the issue that yes, there is some issues with our digestive system. In the same manner, if you are having just a small boil or a small pimple on your face or any other part of your body, it would be showing some redness, it would be showing a prominent pinpointed pain over there. These are the symptoms that are there. What do we do if it is just a small disease? We try to ignore it, or we might just give some first medical aid to it. But if it prolongs for a long period of time, we go and consult a doctor, we say him or her the issue that is there, the pain that is there, and based on the talk with the doctor, he would be suggesting us that go for XYZ test, and from that test he would be able to give a complete confirmation that yes, you have been suffering from this particular type of disease. So every time our body is not functioning properly, it will be giving some indications to you. Your body itself will give some indication to you, your body itself will give some signs to you, your body will give some symptoms to you. What is it called now? The signs are called as the symptoms. The body will give the symptoms to you. Let's have a look at it. What does disease look like? Do disease have some identification, how it will be looking like? So we shall just have a note on it. When a person is affected by a disease, either the normal functioning or the appearance of one or more system of the body changes for the worse. Like for example, I will just take one more thing. Our normally eyes, how do they look? If we watch TV, if we are in front of the screen for a prolonged period of time, you will be seeing that there would be some type of redness in our eyes, there would be itching in our eyes. If it has been continued for many days, the condition of our eyes would become worse, and then we will have to go to an ophthalmologist, an eye doctor, ophthalmologist, for a consultation, and then he or she would be saying that no more sitting in front of the screen for a week or for 2 weeks, and you will be have to putting the drops 2 times a day, 3 times a day, like that the suggestions would be given. So it changes, one or more system of the body changes for the worse. These changes give rise to signs of the disease that are called as the symptoms. Signs of a disease are called as what? They are called as symptoms. So generally in the medical term, in the medical field, what are the signs of your disease? No, we don't say so. We say what are the symptoms of your disease. So symptoms are what? Symptoms are signs itself, but more a medicinal touch, medical touch has been given, professional touch has been given when we call it as symptoms. On the basis of the symptoms, the physician looks for the signs of a particular disease and conduct tests to confirm the disease. I will say one more example over here. If we are having temperature, okay, temperature, first aid that would be given from a home, you would be given with paracetamol, you will be given with dolo, you will be given with some other combinations of medicines. Three times a day that combination would be looked into, okay, and even after 3 times also your temperature is not coming down, your temperature is not falling down, you will be rushed to the hospital. By your parents, you will be rushed to the hospital. Your parents would be saying that as a first aid we had given paracetamol, we have given some XYZ medicine, and still the temperature is not coming down. What will the doctor do? The doctor will examine you. The doctor will examine you. He will look for different symptoms that are there in your body. He will be asking you a few questions, and then finally he will suggest you that yes, let's go for a blood test. And from the blood test, when the result would be coming, it would be made very clear that what is the reason of such type of temperature variation in our body. So there are some signs that your body is indicating. Your symptoms are being given. Symptoms are being given by your body. We will be going to a doctor to seek medicinal help, and then different types of tests would be conducted, which will be confirming that yes, you are being affected, you are being affected by so and so disease. So this is how a disease will be looking like. How will you categorize disease? There are two ways of categorizing disease. First is acute disease and chronic disease, while the second one that follows up is the infectious disease and the non-infectious disease. Okay, we shall have a look at all of them. Acute disease, chronic disease. If suppose you are having headache, okay, you are having headache at 2 o'clock right now, 2 o'clock in the noon, and what are you doing? You just go and put some balm and you go to sleep. By the time you are by the time it's just 3 or 3:30, you can see that your headache is gone. Okay, so that type of disease is called as an acute disease. Acute disease is a disease which will be there in your body for a short period of time, while a chronic disease will be affecting your body for a longer, much more longer period of time. So acute disease and a chronic disease. Let's have the difference. Acute disease lasts for a short time, while chronic disease lasts for a very long time. So from this itself it can be very clear that what can be an acute, what are the different acute diseases that are there, what are the different chronic diseases that are there. So if we categorize cancer can be an acute disease or a chronic? It's a chronic disease. You are having upset stomach, is it a chronic or an acute one? So it's an acute one. Such diseases do not cause any major effects on our general health. Okay, there is no change or appearance in our body. But suppose if you are having a very severe disease, that actually brings out a change in our body. A patient who is suffering from cancer, patient who is suffering from heart attack, diabetes, you can see that for in their body changes are being brought because these diseases are there for a prolonged period of time. So next point, a person suffering from an acute disease recovers completely after the cure. A person suffering from a chronic disease generally does not recover completely, even though the recovery chances are there, but it will be taking much more time, much more prolonged period of time would be taken. Next one, since acute disease lasts for a short time, they do not lead to loss of weight or fatigue. Okay, so loss of weight or fatigue is not seen, but if it is in the case of a chronic, yes, there is loss of weight and there is fatigue. Fatigue is the tiredness. Okay, so since chronic diseases last for a long time, they lead to loss of weight and fatigue. Okay, so these are about the differences between acute disease and chronic disease. We have classifying the disease. First classification is based on the term, whether it is for a short period of time or for a long period of time. So a short period of time it is called as acute disease, long period of time it is called as a chronic disease. Next one is called as the infectious disease and the non-infectious disease, what we are facing right now, infectious disease. Okay, so when we are having certain pathogens, and we have certain pathogens, what are pathogens? That's what you have to comment in the comment section today. Okay, so you have to define what are pathogens. So infectious disease and non-infectious disease. Infectious disease is caused due to an attack of a pathogen. Non-infectious one, it is caused by the factors other than the pathogen. Pathogen you have studied in your 8th standard, I remember that very well. Next one, caused by extrinsic factor. Extrinsic factor are the outside factors than our body, and in non-infectious diseases are caused because of your intrinsic factor, that is within your body. Okay, transmitted from one person to another, do not get transmitted from one person to another. Transmission of disease occurs through direct contact or some medium like air, water and vectors. While transmission here is in the case of hereditary disease from parent to the offspring. We have many different types of genetic disorders that has been given by the parent to the offspring unknowingly. Okay, it is given unknowingly. We don't know what are the steps that are taking place when a combination of genes are happening. So during the combination of genes, when this happens, there are some type of errors that are being developed which will be leading to a disease. So unknowingly a parent is responsible to give a disease to the child. Like for example, Queen Victoria, the entire heredity, when you will be having a look, she is responsible to give a chromosome to their male child, and the male child will be suffering from a disease. Okay, more detail about it I'll be just explaining later. Next one is community hygiene can reduce the occurrence of these diseases. While here in the non-infectious one, community hygiene is ineffective in reducing the occurrence of these diseases. Now we come to the examples that are there. Examples of infectious diseases are cholera and malaria, while non-infectious one are diabetes and goiter. From this itself it will be clear that what are pathogens, what are vectors, and what is it responsible. Infectious diseases and non-infectious diseases, they are also known by one another name. Read the textbook and even comment that in the comment section. So there are two things to comment today. First one, you have to define what is a pathogen, and second one, you have to say the other name for the infectious disease and the non-infectious one. Some of you I think already got the answer also, but no problem, I still need that in the comment section. Okay, here you can see the infectious disease and non-infectious diseases. So just take a moment to pause the video and see the pictures that are there. Okay, now I come directly to the causes of diseases. How can you classify the disease on the base of what are the factors that are responsible to cause the disease? So generally, like according to our textbook, we have just 5 mentioned over here. There are many other factors. If you want to split them separately, we can get n number of factors, but putting it up all together, we are having just 5 different factors that are there which are responsible to cause a disease. What are they? So pathogens that are there, then you are having poor health and undernourishment, malfunctioning of body parts, environmental pollution and genetic disorders. These are the factors that are responsible to cause a disease. Like for example, when we focus on the pathogens itself, we have bacteria, virus, fungi, protozoans and many other nematodes, many other worms that are there. How do they look? What are the different types of diseases that they are causing? It's been mentioned over here. Okay, so you are having bacteria, they are responsible for tuberculosis, diphtheria, typhoid, cholera, tetanus, dysentery and pneumonia. Virus, obviously I don't need to mention about the corona right now. Common cold, herpes, measles, AIDS, chickenpox, smallpox. Fungi, ringworm, athlete's foot, candidiasis and histoplasmosis. Then protozoan malaria, then giardiasis. You are having the sleeping sickness, leishmania, Chagas disease, and multicellular parasites are like roundworm infection and tapeworm infection. Okay, these are all what? These are all the different diseases that are caused because of a pathogen. I'll explain this later. This is just an introductory part. Okay, poor health and undernourishment. You have come across the words like marasmus, kwashiorkor, scurvy, beriberi, okay, rickets. All these are diseases that are related to malfunctioning, not malfunctioning, sorry. It is related to the malnourishment. It is related to the malnourishment. So an individual is not getting an adequate amount of the required nutrient, and he or she is having different types of symptoms in the body. So that's about it. Poor health and undernourishment. Next one is malfunctioning of the body parts. If we just have a cut open section of our body, there are many organs that are all working together to have a proper functioning of our body. If just there is one single error, in one single mistake in the functioning of the body parts, it will be leading to the entire system failure. Kidney failure. Where in the parayindad, one single bean shaped structure it is. It's a paired bean shaped structure. If suppose if it's not functioning properly, it leads to death. It leads to death. So that's about malfunctioning of body parts. Next is environmental pollution. A sum of different types of pollution has been included over here, and how is it causing an effect over the human is been mentioned. So you are having air pollution, water pollution, soil pollution. All these are contributing to like headache, respiratory illness, cardiovascular illness, gastroenteritis, cancer, nausea, skin irritation, all the different types of disease. Oh my god, so many diseases. And then finally genetic disorders. Okay, I stated this earlier. Genetic disorders are the disorders which we don't know would be coming into our body, okay, because this has been something that has been given by our parents as a course of genetics, as a course of transmitting the characters. Sometimes some bad characters enters in our body which is responsible for getting a disease, a disorder. Like for example, few are polydactyly. This is very common in the society also. നമ്മൾ കണ്ടു കാണും 6 fingers 7 fingers, ഒന്നും വലിയ പ്രശ്നമില്ല. You can just operate that, or you can keep it like that itself. It's all totally fine. Then you are having hypertrichosis, excess growth of hair over the body. Then you are having the progeria. Here you will be seeing that the individual will be of 6 years, of 7 years, but will be having a look like that of a very old person, very very old person. The individual won't survive very long. Death is there. Then you are having hemophilia. This is what I was talking about, the royal disease. Okay, hemophilia, the person bleeds to death. The wounds that are there, they don't clot, and death is taking place. Then you are having Down syndrome, where you get one extra chromosome. You get one. We have 46 chromosome, but in Down syndrome we get 47 chromosome. These are all genetic errors. Then you are having sickle cell anemia. Our blood cell is like udnuvada. Okay, you can imagine the shape how it is. By the sides it is a little bit bulged, in the center it is a little bit pressed over here. Like that is our normal blood cell, but in the case of sickle cell anemia, it takes the shape of a moon, crescent moon like structure. So it's called as sickle cell anemia. So these are all diseases. So if the parents are carriers, they are responsible to give this disease to their next generation. It's through the pedigree we can analyze it, we can know about it. Okay, so that's where I stop today. Just read the content from the textbook. We shall meet in the next class. Thank you all.